Pelvic floor health is often only discussed after pregnancy or whispered about when something feels wrong. But the truth is, the pelvic floor affects movement, stability, bladder health, sexual function, and long term quality of life for women at every age. Welcome. I'm Tierra Duncan, and this channel is all about women's health, from hormone and nutrition to fitness and stress. Real science, real conversations, and tools to help you thrive. Today, I'm joined by Dr. Jill Arnold, physical therapist and owner of Arnold Physical Therapy, to talk about pelvic floor health, common misconceptions, and why this conversation matters far beyond postpartum recovery. Welcome, Jill.
Hi, thanks for having me.
So many women think pelvic floor therapy is only for after pregnancy or childbirth. Who actually benefits from pelvic floor care, and when should women start thinking about it?
Good question. I'm actually going to take off on your postpartum, and I would love to say that it's not only for postpartum, it's all during your pregnancy too. And a lot of my patients are getting smarter and say, just like when you're going to have a total hip or shoulder surgery, that orthopedic surgeon is going to recommend that you get PT before surgery for better outcomes afterwards. So if you think about coming in for PT, to do even external pelvic floor to make sure that your coordination is okay, your awareness is okay, but also strengthening your abdomen, your back as you're constantly growing during the entire time of pregnancy, you're going to come out with better outcomes too, to be able to care for you and your baby. Improved awareness. My patients come in afterwards, and I'm like, tighten your transverse abdominis. Yes. So I just like to put that plug in for all during, not only for afterwards. Um, Also, I would like to say, like, our high impact athletes, women doing HIIT and CrossFit, runners, marathoners, like all that impact is on the pelvic floor and that force translate. It's a lot for the pelvic floor to handle repetitively. I'd also like to say cyclists because of where that bike
Oh.
seat sits. It can create pelvic floor tension, and it can sometimes irritate the pelvic nerve that innervates the pelvic floor, which is called the pudendal nerve. Um, Not saying don't do it. It's just be mindful. If you start noticing some tension, tightness, pain, get help. Also, women in perimenopause, it's like the hot topic and it's a real deal. But with all the hormonal changes, um, it might make you all of a sudden start having problems that you've never had before. It might light up previous issues that you thought weren't a thing, now are a thing. And so I would definitely say all of those categories as well.
All the above.
All of the above.
Yeah, so basically, not just after pregnancy, but during the process, because the
Mhm.
more awareness, strengthening, lengthening,
Yes. Yes.
relaxing that you could do.
Exactly.
High impact athletes, right?
Mhm.
Because a lot of us are focused on being overly tight.
Yes. That's like society.
Yeah, and then perimenopause, because those hormonal changes actually do impact our uterus. the
Yeah.
whole,
Your
the
tissue
whole,
integrity, the
yeah,
ligamentous support, everything.
yeah. So it's interesting because we often hear like just do your Kegels.
Oh, I hate that.
Yeah. what what does that advice like miss, and why is like strengthening your pelvic floor not always the answer?
Yeah. So many things to answer here. Sometimes just straight up, sometimes strengthening isn't the answer. Sometimes you actually need to relax. So in our society, especially as parents, we're like, you have to be here, you have to get this, and it's like overworking, never a break. So our society tends to be uptight and really tense, and our pelvic floors tend to follow suit. And so sometimes, like, women, because they're trying to do everything, they're like, oh, we always have to be Kegling. So then, like, I feel like women want to walk around in a perma Kegel. I'm like, no, this is not good. And so you need a certain resting tension there to just support you, but you should not be in a Kegel state all the time. And sometimes that can be contributing to pelvic floor tension, pelvic floor spasm, pain with intercourse. Having that constant Kegel or tense state can lead to incontinence of all kinds. So sometimes you would think that treating incontinence is just go do your Kegels, but actually,
Mm.
if I find pelvic floor tension, my first thing is looking at flexibility and also dying down that pelvic floor tension. Because if you're always like this, how can you do a good bicep curl if you're always like this? So we need to kind of lengthen tissues to then kind of increase your awareness again and to strengthen over the whole muscle length rather than doing this, because then it's just going to worsen the tension in itself. My other issue, when they say just your Kegels, I've had patients walk in with prolapse, which is, dropping
Mm.
of the pelvic organ down the vaginal canal, sometimes out of the body. And they're like, I don't know why this happened. I've been doing Kegels, like my OB-GYN said, for 20 years. I've been doing them every day. I'm like, well, let me see. Let me see what you're doing. And they're doing it incorrectly. And nobody
Oh, okay.
checked. And so, but sometimes after having kids, your awareness is not there. So what you think you're doing isn't actually what you are doing. And then if you have tears, if you've had surgery, if you have scar tissue, if you have nerve injury, it can make you asymmetrical. It can make you doing the wrong thing. So we've all heard of practice makes perfect, but it's actually, I had a teacher in physical therapy school that was so right when she said perfect practice makes perfect.
Mm.
Because if you
Mm.
practice, even if you have the right movement, but half your pelvic floor isn't working, or you're moving asymmetrically, you're training your pelvic floor incorrectly to support you. But also in the case of those patients I've been practicing the wrong, actually, instead of Kegling, they were pushing out. But to them, they felt like
Oh,
they were Kegling.
right. They felt pressure, so they kind
Right.
of
So
right.
then maybe they had a mild prolapse, but because of having years and years of practicing what they thought
Mm.
was correct, but was actually the opposite, could they have given themselves the worsening prolapse? That's
Yeah, I was fortunate enough, like week, I think 14 of my pregnancy, I strained my tailbone
mm,
doing like a simple, like a very light deadlift, and that never happened to me before.
yeah, yeah.
So I was like, let me see a pelvic floor PT because I can barely.
Good job.
And that was the thing that really surprised me. Is I thought she was going to say, it's weak or whatever. And she's like,
Mhm.
no, girlfriend, you need to learn how to relax.
Exactly right.
Right. And that even what really surprised me was in order to really benefit from the process of birth and not, I ended up having C-section, but we geared up for me to have a
Yes.
vaginal birth,
Mhm.
um, and did all those practices. It was really surprising to me about how much it was about relaxing because I feel like in movies and TV shows, it's always like screaming, holding on to
Yes.
something, and so to have this mindset of learning how to breathe through the
Mhm.
pelvic floor and
Yeah.
lengthen and relax,
100%.
and also just being like a type A, go go go,
Yes.
right?
You hold yourself
You're
to those standards. You're
yeah.
this, and you
Yeah, and
just need to let it go.
you think working harder equals better function,
Mhm.
but that's actually not the case. I think your analogy of, like, you wouldn't train your bicep by always walking around flexing it.
Right.
You have to
Get the
muscle
full
growth,
length.
you have to lengthen and
And
contract in
strength it.
order. Yeah,
Yes.
yeah.
Yeah, it's gotta be that balance, it's that length tension relationship that you need to have the proper relationship, or it's gonna end up being a hot mess, and then one thing leads to another thing, and that's just like an onion. So then by the time you get into PT, your PT is having to peel back the layers of the onion and reteach everything. But also you said, C-section, and I don't want women to think that their pelvic floor is not impacted,
Oh, wait,
because
oh,
you're
oh, yes.
still gaining weight. You're still carrying that baby
Absolutely.
over your pelvic floor the entire time of pregnancy.
Yeah, I actually, right, had been preparing for vaginal birth. That wasn't
Mhm.
what happened.
Right.
And there were, after I was healed enough from the incision, when we went in and we looked at stuff, or she looked at stuff, I should say,
Yeah.
um, there was still a lot of pelvic floor considerations, right? Because I
100
had
all the time.
35, 40 pounds of this weight.
For how
I think a lot of
long?
women don't realize you have relaxin. So that's a
Yes.
hormone that
Yeah.
literally, makes your
Relaxes
joints
all of
and
your
ligaments.
ligaments.
Yeah, so everything kind of, and
Yeah.
then, and I don't know how common this is, but I know for me, the first few weeks, my belly felt like jello, but not like a fat way, just I felt disconnected.
Yeah. Like lack of control. Lack.
Yeah, like I was like touching a bowl of gelatin.
Yeah.
Yeah, it
Yes.
was very, the pregnancy belly is harder, more firm, I should say. Yeah, it was just an interesting experience, these
Mhm.
assumptions. So being in a CrossFit gym, it's common to hear like, oh, gotta go to the bathroom before I go to the workout, or oh, I peed during double unders, ha ha ha, right? Or oh, I have some pressure. Um, why do you think that there is kind of that kind of cultural mindset around pelvic floor dysfunction, and kind of what are other uh, symptoms or signals of pelvic floor dysfunction that you see?
Yeah, so I would say, so this goes along with the cycling, or sometimes after childbirth, that nerve that I talked about gets injured. So, like if you
Mm.
have any discomfort wearing tighter pants or wearing underwear, or discomfort in sitting,
Oh,
those
okay.
are all signs of pelvic floor dysfunction that can be treated. Um, Inability to fully empty your bladder, so you feel like there's a good chunk of urine left in there, that's a sign of dysfunction. Also, that need to then empty right after you just urinated, like there's still more and you have to re-urinate. And then urinary frequency, you got to go all
Mm.
the time and it's taking over your life. That's a big one. Um, Having to strain to empty your urine or your feces, what happens is your bladder should contract to empty, but your pelvic floor should relax. So that's kind of like a response that should be there. But if you're feeling the need to strain, to push, to empty your urine or your poop, basically, that could be a sign of being too tense, and that you need to have help relaxing or down training or even manually releasing your pelvic floor muscles to let things pass through. Because if there's enough of that straining over time, you can contribute to the prolapse issue, which is a whole other issue that you have to deal with. Um, Also, that like putting the key in the lock of the door and like I have to pee, that urge, like as soon as you pull in the driveway, I have to pee now, now, now. That's a sign. Of course, urinary incontinence, pelvic pain, pain with intercourse. Also, hip pain that doesn't get better with your typical PT. It could
Mm.
be, I mean, look between your hips. There's your pelvic floor, So I've had a lot of women come in with hip pain that we go internal, we release from the inside, and it's a huge dramatic improvement in their hip pain. So any of those symptoms, tailbone, obviously.
Yeah, got firsthand on that one. So for a woman that's listening to this, but might feel like a sense of embarrassment or
Yeah.
shame, or just being uncomfortable around the idea of the pelvic floor being treated, what actually happens during evaluation?
Yeah. So you come in and we go over your medical history that you've hopefully, like filled out before, but then we have a conversation. But before I even get into that conversation, I really want to say it's important to interview different pelvic floor PTs to find one that you really connect with, because this is a vulnerable type of PT, very private, right? So I just feel like the more comfortable you are with your PT, the more relaxed you're going to be able to be. And then the better you're going to receive releases, the more you're going to get from your therapy. So find someone you connect with. But then in the conversation, I want to hear your story. I want to hear what brought you here, where you were, where you are, where you want to go, what are your goals, all that kind of stuff. Then I'm going to do test and measurements. I'm going to look at your posture. I'm going to look at your spine range of motion. I'm going to look at your flexibility, your core stability. This is all with your clothes on, so don't freak out. Everything, you're fully dressed, okay? The amount of time that you're actually undressed is very small compared on that first visit compared to everything else. Um, and then I'm going to also ask questions about your bladder habits, your bowel habits, your period. If you have
Mm.
intercourse, what is that like? I get very detailed. Does it, do you have pain with external stimulation? Do you have pain with entry? Do you have pain with external stimulation? Like all of the questions. We just go over everything. But then also, again, before you ever take your pants and underwear off, discussing all that, but then I'm giving you education as we go
Oh,
along.
nice.
So I'm educating you what's the right way to sit on the toilet to fully empty your bladder and to help you relax things, to help things pass easier. Bladder tips, how to start dying down that urge, how to start increasing the time between voiding so that you aren't having to go to the bathroom all the time. I'm educating you on your own body and how to work with it a lot easier. Um, and then also the anatomy. I feel like so many women don't understand their own anatomy, what each part is called, which then it really leaves you in a deficit of being able to communicate properly about what's happening with your body. So lots of education. And I feel like the patients love that as much as everything else because it's empowering to know about your body and to understand it. And then we come to internal and external. You go to the bathroom, you undress. Then I'm looking at external pelvic floor. I'm looking at the appearance, looking at any tears that may have happened, all that. Looking at your coordination. What happens when you cough? What happens when you hold your breath? Can you Kegel? What does it look like? Then we go into, and I check external for external pelvic floor tension. Then we go internal. You have 3 layers of pelvic floor muscles internally. So I check all around those. And at each layer, I go around the clock. And we just are assessing, we're talking, we're communicating. What are you feeling? This is what I'm feeling. Then I check your strength, your coordination, your endurance, all that kind of stuff. And then at your first appointment, it's basically what I think if you need manual treatment, if you need exercises, if it's just a ton of education, behavioral retraining, all that kind of stuff, all that is your first visit.
That's really comprehensive. Excuse me, I appreciate what I really picked up on was the education aspect, right? That's really big of like my platform is the education on
Mhm.
hormones and how they impact us through different stages of life.
Yes.
And it really, even just your period, right?
Hmm.
Going back to female anatomy, just not understanding what happens during your cycle
Right.
and
Right.
to the various aspects of your body. Yeah, that's I love how in depth that is, but also how much you both are looking for like the diagnostic aspect, the questions, but also letting women feel like, okay, now I know why this is happening to me.
Right.
I can do further research, and
Yes.
there is that empowerment aspect.
Yes, and
Right?
I am a talker. And as you're answering my questions as to bowel, bladder, intercourse, all that, I'm putting together the pieces of your puzzle in my head. Like, does
Mm.
it fit into weakness? Does it fit into nerve? Does it fit into tension? Does it fit? And I'm talking through my thought process, and then I put it together with what I find physically too. So it's you and I are kind of walking through it together, putting together everything as we go.
If there was, well, I'm sure there's more than one, but if there was one misconception that you could dispel about pelvic floor health and treatment, what would
Yes.
that be?
Oh my gosh, I would take away the taboo of it all because
Mm.
I feel like so many women aren't getting help because we still have to whisper about these topics. And I'm just like, To be honest, like, it just irritates me because we're so free to get, like PT for tennis elbow or whatever. And if you look at the job of the pelvic floor and all the changes that we go through over a week, much less over a month, much less over like a lifespan of being a woman and everything our pelvic floor does. The things that happen, if something goes wrong with your pelvic floor, it impacts your confidence, your ability to leave the house, to do the things you enjoy. It impacts your relationship, your marriage. It impacts your ability to mom. I mean, it can be devastating to who you are and the relationships all around you. So I really wish that we would stop treating it like it's some big secret or ha ha ha, like
Right,
she does
right.
pelvic floor physical therapy. Yes, I do pelvic floor physical therapy and I help women on a deep level and I treat shoulders, I treat hips too. But for me, that doesn't have the depth of impact for a woman as the pelvic floor and all that it carries with it. So I just feel like I wish there would be more respect and more openness in conversations about this, because the more that we talk, let's face it, we're all women. We all go through some aspect of these things. Even if you never have kids, you have issues.
Yes,
You know what I mean? Like
yes,
over the course of
totally.
time. So I feel like the more that we talk about it, the more that we get people help. So just being open and honest and just doing it out of the love of helping others, spreading that word.
I love that. I There's so much that I think women already carry, right? Whether it comes to things like mom guilt, or if you're not a
Yeah.
mom, just like trying to balance work and life and pressures. And, I think the last thing that we need is to feel shame around something that's very natural and
Yes.
a part of who we are. And also, women go through perimenopause, women go through menopause, we
Yes.
go through puberty, right? And there are
There's so
significant
many
changes
changes that
that
we go
happen that are
through.
not um, talked about. Yeah, Jill, I really appreciate your time today. Like, uh, the things you've talked about, like that it's not just for one stage of life. It's not just
Mhm.
post baby. It's literally for all stages, right?
Exactly.
If you have dysfunction somewhere, let's go see somebody and let's
Exactly.
see what's going
Get it
on.
done.
Get it done. That it's really about not just the treatment, but the education
Right.
aspect, right? Learning your body, what what is pelvic floor, right? It's a lot
Right.
of things. And then ultimately that there is nothing to be ashamed of. And
Nothing
that
at
this is where we hold our power, in fact.
all.
And we have every right to get things treated if they don't feel good. If you had a cold, like I do right now,
Right.
you go take medicine.
Right.
Um, you break a bone, you go get it fixed. If you have pelvic floor dysfunction, you see a pelvic floor therapist.
Exactly.
Where can
Exhaust
listeners
all
oh, I'm
those
sorry.
conservative it's okay, but exhaust all those conservative measures before you go and do medication and surgery, just like you would
Right,
for any other part of your body,
right,
It's
right.
go try the things, and if you have because, like, some people are like, "Oh, I tried pelvic floor physical therapy, it doesn't work." Get a second opinion.
Mm,
Try again,
yeah.
because some people might have taken different courses or different levels of courses or have different things in their back pocket that they might be able to pull out and try, and that makes all the difference for you.
Yeah, and then you said, the first one of the first things you said about treatment is find a therapist that you, match with,
Can't
right? That you
emphasize it
connect with.
enough. Yeah.
Yeah, yeah,
And
right,
at
right.
least, like, for me, I have a 50-minute appointments. Like, we're spending almost an hour together every time. So I want you to be comfortable. And if you're not comfortable with me, find someone you are being comfortable with, because the better you feel when you're here, the better you're going to feel when you're leaving here. And the more
Right.
motivated you are to carry through with exercises and all that kind of stuff.
You're doing amazing work. Where can listeners find you?
So there's arnoldphysicaltherapy.com. You can email me. I'm best at email. It's arnoldphysicaltherapy@gmail.com. You can also call me. It's 443-955-1458.
Awesome. Well, thank you so much for your time, and we'll see you guys in the next episode.
All right. Bye. Thanks.